3, 2, 1.
Oh. I show Speed's shocking Suey injury, Jake Paul's broken jaw, and a whole slew of other popular YouTubers and their unexpected medical moments. Today, we're breaking down and reacting to all the accidental injuries from some of your favorite YouTubers. Let's dive right in.
3, 2, 1.
Oh.
Dude, I can't even see my helmet leave frame.
I know.
Call 911.
Oh,
Yeah.
what do we do?
Wow. This is something that could actually take your life. Type of explosion, these chemicals that are firing could be thousands of degrees. So just a second exposure to the heat can cause significant amount of flash burn injuries to the skin, to the body.
So when people experience trauma, in terms like blunt force trauma, it's not uncommon for your body to seize up in whatever position it was in. You can see it right here, like your right hand that was grasping that front handle there, clamped up in that way.
Look how fast the head went back. Not even enough time to react. So that means it can go back further than it is designed to do. So you can have significant amount of whiplash injury, cervical spine injury. Very, very, very dangerous.
And your face was bleeding so much it was down on your neck. And I think that was confusing some people. They thought your neck was bleeding. So they were applying pressure there first until it was more obvious it was coming from your cheek.
Gotcha.
People panic in that moment when you're trying to assess somebody. There is a systematic way to go about these things. Airway, breathing, circulation, disability, and exposure. Airway, he's talking, good, he's got an airway. Breathing okay, not short of breath. Circulation, you got a pulse, so you're perfusing your brain, you're talking. Disability, neurologically, moving everything, does everything feel normal? And then exposure, look at the skin everywhere and find if there's any other issues.
It's called a coconut crab because it can actually cut through a coconut.
That is a big crab. No, thank you.
Crab battle.
Chris Pontius took the coconut crab and put it on my underwear. It didn't do anything at first, but when it latched on, it was the most painful thing I've ever had on my butt.
With that amount of force, you can actually pop open the tissue and the skin, which can rupture open, increase the risk of infection, especially when we're dealing with marine life and the water and the bacteria that is in there that can get into the wounds. There's a lot.
Ow! Ow! Get him off! Get him off! Oh no! Oh my!
Oh, almost looks like skin was taken off, but luckily it's a lot of flesh there, not a lot of underlying structures that can be damaged. Having to close up the wound, irrigate it really well, and now you potentially have scars to that area. So, Steve-O, be careful out there. Oh, the Jake Paul injury. Sometimes when you actually get injured, you don't notice the pain right away. I haven't seen any interviews with him where he describes it, but a lot of times it takes like at least a couple seconds for you to be like, oh, something bad happened.
This sport has helped me so much in my life. I think my jaw is broken, by the way, so yeah. It's definitely broke.
The jaw fractures that we see are usually ones that get hit on the side of your face. We don't see a lot of jaw fractures that get hit right on the chin itself. The ones on the chin itself probably going to cause some more fractures to the joints themselves or the angle, the ramus. This is his CT scan, and remember when you're looking at a CT scan, your left side is it's opposite. So when we're looking at our left, it's actually the right, looking up from the feet up to the head. The left front part of his jaw on the mandible got fractured, and then the energy came out on the right side.
Oh, that was so... That was so...
Can you
Oh, it's pretty
lie down
swollen.
here?
Yes, I
Thank you.
can.
And have the ankle stabilized.
Landed weird and likely rolled it. Can have what's called an inversion sprain. The ankle turns inside. You get significant amount of pain on the lateral aspect of the ankle. The majority of the ligaments are where you have 3 ligaments. Usually people end up injuring 2 of them. It does hurt a lot and will swell up a lot.
I did the Suey, then I like fell on a chair, then I like twist, it just like that.
So you have a pronation, it's like this?
Yeah.
Okay. I'm gonna press in some points. Does
Okay.
this hurt?
No.
It's actually a really good assessment. She's looking for a Maisonneuve fracture, which is a proximal fracture of the fibula, squeezing high up. Really good to make sure that there's no tenderness to that area. Excellent.
Excellent.
It's okay.
Oh, I'm so sorry.
We don't mean it to hurt, but we need to find out where it's painful, and so it just says normal reaction, like whoa, 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 whoa.
I have to get you to the hospital to get an x-ray. You have a positive Ottawa.
A positive Ottawa. So we have Ottawa ankle rules, specific rules to see, do you need to get an x-ray for an ankle injury?
And you can swelling?
Yeah.
So what I'm doing now, I don't want the swelling to be any larger, so I'm lifting your foot up in the air, okay?
Okay.
Remember, rest, ice, compression, elevation. Rest, okay, fine. Ice is really just there to help like numb the area. Compression usually means like we'll actually put like an ace wrap on the area, and then elevation, so you elevate it so the swelling helps to get out.
Well, in the process of filming the TikTok, I was like, yo, like it'd be cool if I jumped off this playground. So I jump off, I do some like 360 with this Nerf gun in the air. I'm going to land. As you can see right
Oh, look at that right leg. Right foot gets stuck as his body's moving. His left foot slides, angles in a weird position. He ended up having a posterior fibular fracture, I believe, which is a weight-bearing injury. So meaning like if it's just your fibula, you can step on it. If it's your tibia, you cannot.
We're in the middle of this park. I don't have anything to like walk on. I don't have a crutch. I don't have anything. So then I start literally hopping to the car on one foot. My ankle right now is numb. I cannot feel anything.
We'll see people who come in with a lot of fibular fractures for different rolling your ankles or these type of awkward positions. Get an x-ray, see what's going on in there. Sometimes there's hairline fractures, sometimes they're really displaced. A lot of times the ankle will swell up even a lot more with sprains versus fractures. But at the end of the day, if you're having significant pain in the ankle, you need to get an x-ray.
2, 1.
Oh, hit too far forward. Your body heals best when you give it the tools it needs. And one of the biggest is sleep. That's one of the reasons I created Do Not Disturb by Life Happens, a doctor-formulated sleep support supplement designed to help you relax. Check out Do Not Disturb at lifehappens.com or on Amazon.
I did break 3 of those little discs in my back.
Hard to know, did he break 3 vertebrae versus did he herniate 3 discs? They're different medical issues. Roll ankle. Oh, head injury. Ow. Yeah, head injury, we got some blood. So my 2 cents as the doctor, that's fine to use this, but maybe just like 1 layer and direct pressure to the area.
All right, just sit up really slow. You ready?
Didn't lose consciousness, doesn't have any signs of traumatic head injury, no dizziness, no nausea, no vomiting, no repetitive questioning. Unlikely that he gets a CT scan, but it's up to the treating physician and how the patient is. Oh, we got some blood on the basketball court. It's going to stain, so you really want to get that off ASAP. The scalp does bleed a lot. It's highly vascular, so it does look a lot scarier than it is. I'm assuming this is probably about 2 centimeter laceration due to the compressive force that can split open the skin.
I'm getting staples, boys.
Yep. Staples are common for the scalp. It's a lot easier to see, easier to remove. The suturing you can do, which I've done many times. Sometimes it's harder because the suture material looks like hair. Just depends on the wound that you're actually trying to close up. Sometimes actually you can staple a head closed without anesthesia if you need 1 or 2.
Please help me.
Okay, so let me look a little closer.
My eyes hurt so bad.
There's a redness to the white parts of the eye. The white parts of the eye are sclera. You can have what's called subconjunctival hemorrhages or hematomas, that blood vessels pop and cause the white parts of the eyes to get very bloody.
Please, what do I do, bro? Please, I'm not joking. They burn, bro.
When somebody's saying that their eyes are burning, the question is there inflammation, something called chemosis, which is swelling of these tissue, which then can cause the tissue to kind of be more plumpy, so to speak. Multiple different things could actually cause this. Coughing, where you pop a blood vessel, rubbing your eyes, eye trauma. Surgery sometimes can cause this to the eye.
Did it with the backpack. This is the dumbest idea. Let's go.
Looks fun. What's it doing?
It was at this moment that he knew.
Oh, a jump. You do a jump, you're off balance. The question ends up being, do you land directly on your shoulder, your arm? Is your arm reaching out?
Ow. My shoulder's really hurting after that one.
A very common injury that you would get if somebody falls and lands on the ground would be either dislocation of your shoulder or a fracture of the clavicle because of compressive force, and it just snaps pretty easily.
So I didn't have a pair of scissors, which is why this is like so primitive here and like caveman-ish, like a Neanderthal ripping it out. I can't trim the on the back.
There's some thick plastic in a lot of these boxes. It could like lacerate pretty easily. You can also have injuries to your hands where you're trying to rip and pull, and you can actually pull your own tendons off some of your fingers. Oh, you gotta be careful with the plastic. You're gonna slice your finger. What did you do? All right. Not sure if he just hit himself in the genitals, into the groin.
My groin!
If he did, painful as heck, you're gonna feel pain in your belly, and that's because the testicles were once inside of our abdomens and descended down and out of our bodies. So the nerves are still within the abdomen. That's why you feel it there.
Got some punishment for you. That bad punishment. You gotta. What is the punishment?
It says you die.
You die.
It says you die.
I did see a nice little Jenga game. Jenga. My wife beats me all the time at that game.
I don't really know what that means, Ludwig.
Oh, what the heck? What the? Shattering some sort of glass on somebody's head. Hopefully that was super easily shattering glass, but trauma to the head. The first thing I always think about when I see that is going to be a laceration. The amount of trauma from that distance, unlikely to cause a skull fracture or intracranial bleeding.
Don't you ever come on my stream again. Oh.
Because there's head trauma, we're definitely going to still get a CT scan of somebody's head just to make sure, because we are not on scene as ER doctors to actually see the mechanism of injury, to fix that laceration, clean it out, clean the wound up. We will either use staples or sutures. Oh! That type of force, you think about a fracture of that metatarsal, which is the long bone of the foot on each toe, but you could also have a phalanx fracture, which are the bones of the toes themselves. Right foot. If somebody comes in with pain to the foot, you're gonna get an x-ray of the foot. Could you cause a dislocation of the bone of the foot? You could. It's a little bit more rare. If it is fractured, depending on how it's fractured, it may need a surgeon to go in and pin it.
Oh, we're juicing it. Yes, here we go. Juicy right now. 3, 2, 1.
You know, at first I want to say good job with the eyewear. Have any of you done this before and not eaten the melon? I mean, who doesn't like watermelon? Let me know in the comments.
The juices are coming out of it right now.
Oh!
Are you okay?
Whoa.
Oh my god! Are you bleeding?
What happened?
Is that blood? Oh god! Are you okay? Are you? Oh my god! It is blood! Do you want me to get a towel?
Obviously, wherever you're bleeding from, make sure you're putting pressure and compression to the area. And don't keep taking it out and checking. You need to hold it at least for 10 to 15 minutes to get it to stop.
Let me get a towel. I fell down on my face.
Oh, you got hit in the face so hard? Wait.
Let me get a towel.
So either he got hit in the face by the piece of melon, or he slipped and fell and hit his face on the ground. It looks like it's coming from his nose.
Your nose! I fell down.
Whoa.
The floor is so slippery.
Ah, okay, so he slipped and hit his face on the ground. Difficult part is to see where it actually is bleeding from. So either your nose smacked the ground, or he cracked his upper lip open because of the compression forces to the ground and his face, or a dental fracture where you fracture a bone.
We're just gonna do Coke versus Coke and pray I don't die.
Oh! Wearing sunglasses, which aren't safety glasses, could actually cause injuries. Glass bottles smacking into each other. I'm assuming they were also shaken, so they're a little bit more pressurized, so to speak. I do not advise any of this because of the risk of injury. Gotta be careful. Yes.
All right, note to self, boys. Don't smash a Coke bottle against a Coke bottle.
Wow, very lucky. Laceration to the right side of the cheek. If it's super tiny, you may not need to sew it shut. You might be able to cause enough compression to get it to stop bleeding and it heals on its own. Versus, do we use a type of medical glue? There's a brand called Dermabond that is very common. It's like a purple type glue that's sterile.
Hello guys, quick update.
Eye show speed. Definitely looks like he's in the back of the ambulance. You can see some seat collars, which are the hard collars that you'd use in somebody who has cervical injuries. And obviously there's people behind him, so he must be in the back of either a transport vehicle, ambulance.
My eyes puffing up. It feels like a stab. It feels like somebody is stabbing my eye with a knife.
Significant swelling to his right eyelid. When you have a lot of swelling of the eyelid, the first thing that we think of is preseptal cellulitis or soft tissue swelling, infection, cellulitis. Then we also worry about orbital cellulitis, which is actually deeper, which would be a lot more pain with eye movement.
And I have a headache like right in this area. So it's like right in this area. It's literally look just exactly like this.
When you think about headaches, you get cluster headaches, you get migraine headaches, you can get tension headaches. A cluster headache is sharp stabbing pain, typically to one eye. Typical treatment of it ends up being 100% oxygen. You can also use some pain medications.
I don't know what's gonna happen to me. You know what I'm saying? I want y'all boys to always be right there with me until I die.
Swelling in itself of that eyelid can cause so much pain that it hits the nerve of the area of your forehead. Other things you worry about that are a little bit more rare have to do with intracranial things, making sure that his brain is okay and make sure that the bones of the skull are okay. They probably would have done lots of different imaging to make sure that he is all right.
But when I get back home, I'm gonna probably chill for travel for a bit because a lot is going on.
A lot of things this could be. Sometimes people can get allergic swelling, like a local reaction to the eyelid itself, unlikely to cause this significant amount of pain. I didn't know so many live streamers got injured. Please make sure if you do have any injuries that you get checked out by your healthcare provider. Please go to the emergency department if you need to get immediate care and you can't get in to see a doctor. If you guys enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.